I am now delighted to introduce one of the true pioneers in the field of integrative medicine, Dr. Herbert Benson. Dr. Benson is the Director Emeritus of the Benson Henry Institute for Mind-Body Medicine and Professor of Medicine at Harvard Medical School. It's important to remember that the mind-body connection that is so central to many of the topics that we will discuss here today was not so obvious just a few decades ago. Dr. Benson's work on the relaxation response was one of the first to quantify the physiological interactions between the mind and the body, and that we now take for granted. The growing collaboration between the Benson Henry Institute and the Osher Center has been an important catalyst in making the idea of the center without walls become a reality. Dr. Benson.
Good afternoon. What I'll speak to today will be a personal perspective of what's happened over the last 40 plus years. 150 years ago, there was no medicine other than integrative medicine because scientific medicine had not yet evolved. But starting with Louis Pasteur in France, defining a cause of anthrax, with Robert Koch in Germany, describing the isolation of bacteria. In Canada, Banting and Best came up with insulin, which could then treat diabetes. In the United Kingdom, Alexander Fleming discovered penicillin, and pneumonia became treatable for the first time. Pneumonia prior to that was a lethal disease, with well over 50% of people suffering from pneumonia dying. This then became treatable. Then at Merck Sharp and Dohme, scientist Waxman came up with came up with streptomycin, which made tuberculosis, the White Death, treatable. And by biblical standards, miracles were being produced routinely. People could see again, blind people who had cataracts. And what occurred was tracing this evolution was the Flexner Report in 1910, brought about by the Carnegie Foundation, essentially saying that scientific medicine, evidence-based medicine, was essential. And in that context, because mind-body interactions, stress reactions, were not easily quantified, they went off to the side a bit and actually became ridiculed. But here in Boston at Harvard, there were periodic reinfusions of, hey, there's something else going on here. Oliver Wendell Holmes starting that, pointing out the importance of the doctor-patient relationship. William James, the mind cure movement was started by him, both graduates of Harvard Medical School. And then Walter B. Cannon described the fight or flight response in the 1920s and 30s. And I had the good fortune of working in a laboratory in the early 1970s, which were studying the opposite of the fight or flight response, which became defined as the relaxation response. And even in those days, as was just pointed out, the bias against mind-body medicine was so powerful that when I received a grant for $300,000 in the early 70s, now equivalent to $1.5 million, Harvard Medical School questioned the wisdom of taking such a grant because considering mind and body in this type of integrative medicine was not acceptable. So I went to the dean of the Harvard Medical School, Robert Herbert, asking his advice. And his conclusion was, if Harvard can't take an occasional chance, who can? Take the money. And then with that, we were able to find other support along the way. For example, one of the earliest people recognizing this worth was David Rosenthal, who, as head of Harvard University Health Services, invited me to lecture at the law school, at the business school, at Arts and Sciences, introducing this work. And then John Henry, believing in this work, made a sizable donation of close to $20 million, and hence the Benson Henry Institute was founded at the Massachusetts General Hospital. And throughout, the support came because we were adhering to the evidence-based reductionistic model which constitutes science as we know it today. And the support for all of these came from numerous people, just several of whom I would mention now. For example, 10 or so years ago, working with Tuvia Lieberman and Manoj Basin, we were able to define the genomics of the relaxation response, namely a set of genomic interactions which led to decreased inflammation, to less energy metabolism, to insulin secretion, and to telomere length. And throughout, the support grew and grew, and we were thrilled with the founding of the Osher Institute and look forward to its collaboration. But the work we are now doing transcends simply the scientific clinical applications of this. For example, if integrative medicine, evidence-based integrative medicine as we know it, is going to be integrated into everyday life, the population has to be changed. And so the work, the educational initiative of our institute under Marilyn Wilshire is now bringing this to children from kindergarten right out through college. We have, and working with people at the Osher Institute, we're trying to bring this internationally, for under the superb leadership, without whom I wouldn't be here, Dr. Greg Fersone is bringing this the caregiver, integrative medicine to people treating Ebola patients. We're also working, for example, with the military, with a NICO to treat PTSD. And so what I see is what began really many, many centuries ago as integration was lost because of the justifiable rise of modern scientific medicine, now returning with a scientific base. So I am thrilled to be here today to watch this evolution as it is today and look forward to a prosperous, successful future that will help the health and well-being of all people. Thank you.